All right, good morning, everyone. It's currently a couple of minutes after, actually, no, it's 10 o'clock on the nose. I just noticed that. We've got a couple of participants coming into the webinar. And so I think what we'll do is we'll start off, and I want to give some housekeeping rules right off the bat. If anyone has any questions, this webinar is structured specifically for question and answers on the vaccination policy. And so we've got with us Norm Keith from KPMG Law, newly minted partner there. And Norm is, I don't think anyone really needs an introduction to Norm. He's been a mainstay of the construction industry for what feels like forever, but luckily we have him solidly in our corner to assist us in this vaccination policy. So the point of today's webinar is that we're going to answer questions in regards to the vaccination policy, the do's, the don'ts, et cetera, et cetera. And everything is, I want our audience to understand, it's framed on the premise of due diligence. And that's the whole purpose of having this vaccination policy. But before I get ahead of myself, if anybody has any questions specific on the policy, you have a Q&A function in the Zoom link at the bottom or in the chat. Feel free to place your questions in either or. We'll be addressing them. We'll be going through the policy itself in short order. It's a rather abbreviated presentation that we're going to go through because we really want to spend most of our time on the questions and answers. So with that being said, you've gotten two versions of it. And some of our members asked why two versions? Well, the longer version is obviously the more elaborate, more extended version. It deals, it's far more sophisticated in nature. And some of our contractors didn't want something that long. So hence we've got an abbreviated version and the shortened version. What we do then with the two of them is either is good, they will satisfy all the requirements that you need. And all it is your comfort level and your level of sophistication. What is that you want to keep, what is that you don't want to keep. But Norm will touch on that just momentarily. So with that being said, I'm going to hand this over to Norm. Norm, good morning. How are you, sir? How was your vacation? You look fantastic.
Thank you. Good morning, everybody. Good morning, Giovanni. I'm here to endorse Jimmy the Greek, the barber who's been cutting hair in Victoria, BC, where I was on vacation for part of my time, although he gives you sometimes more than the money's worth, but it's the best value in town at $15. So yeah, back with a new haircut, a little bit of a rest and a little bit of jet lag from the slight time difference, but doing great. Thank you. So Giovanni and I and the OGCA got together last month and following the presentation that we did on vaccine policy and laying out essentially the legal framework to both explain but also to mandate this idea of having a vaccine policy as the vaccine rollout continues, as more and more of us have an opportunity for both first and second dose. Because all vaccines in Canada that are practically being issued are two-dose vaccines. The Johnson & Johnson one, although approved by Health Canada, has really not been made available in Canada for various reasons. We don't need to go into those. So it's a two-dose vaccine arrangement, whether you have Pfizer, Moderna, or even AstraZeneca like myself. That's all a two-dose. So because now we're getting to the point where everybody has employees that are eligible for the first and likely the second dose, the question becomes, what do you do with policy about vaccines, and then should you use the long form or the short form that we've walked through? The starting point, as Giovanni said, is that employers, contractors, general contractors have a very high obligation to keep workers safe. Workers and other people that might come to the project. So it's going to be your subtrade employees. And so the question becomes, how do you keep them safe when we're still really in the throes or perhaps the latter part of a worldwide pandemic? And how do you avoid the scrutiny that's coming largely from the Ministry of Labor, Training and Skills Development? Remember that part of the ministry's initiative to ensure COVID safety plans and site access and other protocols, masking, physical distancing protocols over the last year and 3 months have been respected is by hiring almost another 200 inspectors from the Ministry of Training, Ministry of Labor Training and Skills Development, as it's now called. So they're going to be continuing their role. In fact, I'm getting calls from clients every week, seeing more and more inspectors coming in job sites. And one of the things they're not doing is giving guidance on vaccine policy. So we still have a gap or a vacuum, really, where the regulator in Ontario is not giving clear and reliable guidance on what to do about vaccine and vaccine policy. So it's left up to you, the employer, and that's why we develop these short and long policies. The other interesting development early in June of this year was that the government, the Ontario Government Ministry of Long-Term Care, took the first step of any government agency to say, as an employer in a long-term care facility, you need to either A, have all of your employees vaccinated, or B, have proof that they have a medical reason, a human rights disability exemption from vaccination, or if neither applied, you had to take the employee through a course to say why vaccination was important, and then you cycle back to either one, they get vaccinated, two, they get a letter from their doctor saying they can't. If they continue to refuse, the implication of the Government of Ontario Long-Term Care Ministry is that they don't meet the conditions of employment set by the government and therefore are not allowed to work. They may be subject to a reassignment or temporary or perhaps permanent layoff if they're a committed anti-vaxxer without a human rights / medical reason why they can't take the vaccine. Those same rules, even though they're not promulgated by the Ministry of Labor Training and Skills Development, fundamentally should apply to the construction industry. Why? Because physical distancing, pre-access screening, and masking at a construction site are not as effective as the vaccine. We've seen with the Delta variant that, in fact, once you've got one of the three actively approved and available vaccines in Canada, the chances of getting the Delta variant are 10% or less. If you get it, you're not going to go to the hospital and you will not die. We've seen anecdotal evidence in Ontario, and this is really quite tragic, is that about 90% of the people that are hospitalized, intubated, and sometimes die from COVID-19, 90% of them had the availability of a vaccine but chose not to. So it shows you that if vaccines work, if you have a committed challenge with your workforce of being anti-vaccination or being an anti-vaxxer mentality, that is something that still puts them at serious risk of getting the disease and maybe worse, hospitalization or worse. So that's why we've developed the long and the short forms. So we'll get into those in a moment. So the fundamental principle is that you have, as an employer, as an OGCA member, an obligation to keep workers safe. The best way to do that, to achieve that under your general duty clause and under the principles of due diligence in court, is by requiring proof of vaccination and or an exemption letter saying from a medical practitioner perspective, you are not able to because you would have a likely a serious allergic or other reaction. So that becomes the standard. And then if you're in that second category, there will be a matter of discussion, accommodation, and that will have to be fine-tuned case by case. There are going to be very few people in that second category. So by and large, you're saying to people, look, we care about you enough that we require you to have proof of vaccination. And then in rolling out the long and the short-term policies with the OGCA, those policies reflect in the long-term form a fairly sophisticated, detailed, well-defined approach to the requirement to have either mandatory or strongly encouraged vaccination, and then the recording of that information. So it's not enough to say, please be vaccinated and we trust you to be responsible and to only come to work once you have proof of vaccination. In my opinion, we've talked about this in the other webinar, that's not good enough, because it's something like when you're stopped by a police officer and they want proof of insurance, you say, well, I have insurance. And the police officer says, well, show me, prove me, verify it. Where's the evidence? And you say, oh, well, don't you trust me? And the police officer has a right to say, I may trust you, but I need verification. So what the policy is encouraging is the conducting of verification by the contractor that their employees and their workers on the job site are in fact vaccinated. Recording that information, keeping it secure, not using it for any other purpose other than the safety of workers, and then really you're going to take it from there. The short form version of the policy we've developed takes out a bit more of the definitional and formality and gives you the essence or the heart of really what the policy is all about. So the main issue is, will you require mandatory proof of vaccination, or only are you going to strongly encourage it, and encourage it by a positive, constructive message about the value of vaccinations, and then deal with the exceptions or the outliers as they arise. So that's the background. That's the importance of the vaccination policy. And that's what the OGCA wanted to help its members to be able to achieve, and to be able to move forward with confidence that they have a safe workplace and that they're going to be compliant with the Occupational Health and Safety Act, and that they can prove to a court through evidence, not just, trust without verification, but trust and verification, evidence of due diligence that they're taking care of safety on the job site. So I think that's a good sort of overview or reminder of what we've covered before, Giovanni. And I'm happy to answer questions as they may come up in the chat, or as you may want to put them forward to me.
So we've got, we're going to start off very strong. We've got some exceptional questions today. So is the vaccine policy that was shared by the OGCA something that we can execute in provinces outside of Ontario, Quebec, BC, Manitoba? Hold on. Yes. How about in the USA? This is important to ask, since many of the operating GCs in Ontario have headquarters that are based outside of the province of Ontario. So,
right. Yeah, let me address that. So the legislation may vary from province to province in terms of COVID public health compliance. So let's take a step back. COVID is both a public as well as an occupational health and safety crisis. The legislation that's largely in Canada been used to govern or restrict activities and have lockdowns is public health legislation, not occupational or workplace safety legislation. Our focus, of course, is on the latter. In fact, I'm not aware of any jurisdiction, including Ontario, that actually has passed a regulation dealing with COVID-19 or infectious disease since COVID started. So it's all been defaulted under general duty clauses or other obligations. So that's why our draft vaccine policy doesn't reference particular legislation. So it's legislatively agnostic. What you would want to do, though, if you do apply the policy nationally, is to make sure that you have some legal advice about the other jurisdictions, to have them, your lawyers, your legal advisor, double check. And we're happy to be retained to help with that process. But we're satisfied that for Ontario, the long and the short form is legislatively compliant. When you look at the US, they're slightly different. Basically state by state, like province by province, they have authority over health and safety laws, but there is some overarching US health and safety, as well as some employment related rules. The best place federally to look for compliance in the US is the Equal Employment Opportunity Commission. And they, in fact, have been quite supportive of employer initiatives to either encourage strongly or to compel employees in certain workplaces where the employees cannot easily work 2 meters or farther apart, i.e. close proximity or congregate settings, to have a vaccine policy that requires mandatory proof of vaccination. So again, the focus is on having proof that your employees are vaccinated. Many US employers in New York State, for example, are asking employees to voluntarily confirm they've been vaccinated. There is not yet a big move to discipline employees in the US that have not been voluntarily vaccinated. That is an issue that's, I'm sure, going to be litigated in the US because they're more litigation prone, and may in fact be litigated in Canada. Going back to Canada for one last comment, The general guidance in a unionized workplace for a policy initiated that is not a consensus or an agreed policy with your union is the KVP arbitration case test. And that we talked about in the presentation I gave last month. KVP, primarily for our purposes, requires a rule or a policy like the policies we've helped develop with the OGCA to be implemented unilaterally if the union won't agree. And that can be done as a unilateral management policy if it meets the KVP rules. And for our purposes, the main point is it reasonable in the context? It can't be something that's prohibited by the collective agreement, but is it reasonable? The word reasonable talks also to the issue of your status under occupational health and safety law and whether you've taken reasonable steps to protect workers. So the two dovetail nicely. So in my opinion, generally speaking, as guidance, the KVP test that applies in every province, because it's been endorsed by the Supreme Court of Canada in the Irving Pulp and Paper case, does speak to the right of an employer to impose reasonable rules unilaterally in a unionized workplace for the health and safety and protection of workers. The question often is, how do you do it? Do you do it in a respectful, positive, encouraging way, or do you do it in a negative, you have to, draconian, and harsh way? And when you do it in the former rather than the latter sentiment, that it's easier to get buy-in from your workers and even the union. So I think the policies we have developed, subject to having someone review them legally for outside of Ontario, are going to be equally applicable in other jurisdictions and other provinces in Canada, and likely also in the US.
I think Norm hit the point on the head when he said, you know what, America seems to be is more litigious than Canada. And what we're doing here is providing due diligence. Due diligence is evidence-based. So, you know what, if you're just assume you're going to court, so ensure that you have the policies and procedures in place to make sure that you can demonstrate that you did something, or didn't do something in a court of law. So this is what the policy is for, to protect you. Again, specific provinces, specific jurisdictions outside of Canada and the United States, their laws might be, different slightly, but I don't think on the whole, I think Norm has done a fantastic job in protecting our members. So there's a slew of questions. I'm going to jump to the next one. So basically, in a nutshell, it's, is this policy just structured for the construction site, or are you assuming that the comments also apply to workplaces in general, i.e. offices and whatnot?
Good question. COVID is no respecter of any particular workplace and doesn't just, inflict people on a construction site as opposed to an office. We know that. I think offices can more easily be adapted or triaged, or you have sort of almost shift work in offices to prevent workers from being in close proximity to each other, more so than a construction site. So therefore, there is probably less reason in an office context to have a mandatory proof of vaccination, even though I believe there's a legal argument to support it. And it really depends on whether, if you're a construction company with a sizable head office that you want people to come back to the office, have you reconfigured so that people never really have close contact with each other, which probably is an unreasonable expense. And if not, then I think you can have the policy applied to your office workers as well as your field or construction workers. So the policy is not limited to construction, but it's more focusing on a question of exposure to each other in the kind of workplace you're working in. For example, if you think of a grocery store, grocery clerks are very clerks are very exposed to the public all the time. So theirs is not just an occupational exposure, but a public exposure as well. So encouraging, if not requiring people in that context, would be similar to what we're trying to achieve in the policy. So it really requires a bit of thought and analysis for the type of workplace you have, but the policies generally are to deal with the COVID pandemic. And we've tailored them specifically to the construction sector, but the principles are essentially the same in any workplace in Ontario or across Canada.
So I'm going to expand on the question about any workplace in general, i.e. the office. What if you have people that are in the office, like, project managers and design workers, and they attend the job site? Would it change your answer somewhat?
Yes, I think so. I think if they're out in the field periodically, they're going to have that exposure risk. The other thing that we haven't talked about, I'll introduce it on the answer to this question, is that all those workers have a right to refuse to do unsafe work. Your ability to have workers be productive will be curtailed or challenged if workers say, well, I'm not going to go to the site because I don't want to get COVID, or have a worker on the site say, well, I don't want somebody who's not been vaccinated and
Yeah.
hasn't submitted proof of have not submitted proof of vaccination coming to the site, because we know the vaccines are very, very effective, but they're not perfect. So you can still get COVID potentially. You likely will not be hospitalized. You might be off sick, but nobody wants to be exposed to somebody who has not been vaccinated because they're potentially an asymptomatic or non-symptomatic carrier. So I think the goal, again, subject to the limited human rights code exceptions, is to ensure that people are vaccinated so that they and their co-workers are kept safe. And the more people interact, of course, the more risk there is, if they're not vaccinated, of communicating that infectious disease to someone else. So I think it's easier, and I think it's sensible to encourage everyone who works for the construction company head office and in the field to be vaccinated and to collect proof of vaccination. And I think, like a lot of things, it might seem awkward or intrusive initially, but because it's for that purpose of keeping people safe, it's lawful, it's reasonable, and it's for the greater good of the employees. So I think most people will come around. And if not, then you're going to have individual conversations with why people are objecting to this. If there is a lawful excuse or a human rights objection, you deal with it. If not, then you're going to have to deal with people one-on-one and either encourage them, give them some time to think about it, make the decision, talk to their doctor, or if you've got a committed anti-vaxxer, then you're going to have a non-compliance problem where you may have to lay somebody off.
So I've got a couple of questions that dovetail really well into that. One is, can you just easily work 2 meters apart, or do you still require the vaccinations? You know what I mean? They're asking basically, if I'm still complying by what the rules of the province are, which are mandated, work 2 meters apart, can I still, I think do I still require the vaccination, or are you still strongly recommending the vaccination?
Yeah, that's a good question. So the question also is partly who is managing and who is in charge of your construction site. If you want to give over the keys of management to every worker to change how the project is managed, which is not what I'm recommending, I'm being a bit facetious in that comment, then yes, you can say it's up to every worker to revise or have their own policy. But I think if it's your project and you're legally responsible as a constructor and or employer at a project, you have the right, in fact, you have the legal obligation to set and enforce rules for the safety of workers. Productivity is not an unreasonable criteria for management to want to have at your site. Safety is an overarching legal responsibility to have. So to have a safe and a productive work site, if you as management decide that a proof of vaccination policy is required, then that's something you have a right to enforce. It's for the reasonable object of keeping people safe. It's for legal compliance. You collect the data, the information for proof of due diligence, as Giovanni said earlier, and you avoid workers saying, I'm not going to work with that worker because they're not vaccinated. I know there's some worry about the vaccinations and risk, and people need to be able to talk to their doctors. And if they have unreasonable risk medically, they will have an exemption, and that's a rare person, but that is the type of person that has a right to be accommodated. And then you're going to have to case by case work through that. But in the main, it's absolutely lawful for the employer to set the rule rather than the worker to set the rule. Otherwise, you essentially have chaos in your workplace, and certainly it's going to affect productivity.
So let's look at that chaos question or positioning. The vaccine policy, obviously, we've come out and we said that we've strongly recommended the vaccine be taken. Can you make it mandatory company-wide? And if so, how do you address scenarios where employees do not have a medical exemption? Again, to your point about the anti-vaxxers, and they just refuse to take it, other than, Darwinism kicking in. But how do we deal with these guys?
Well, that's a good question. As I mentioned earlier, anecdotally, doctors and hospitals and all sorts of facilities that are dealing with the patients that have COVID are saying 90% of the people who are getting sick and dying today are unnecessarily sick and dying because they were eligible for full vaccination. That is a strong and powerful message to keep in mind when you're dealing with vaccine and vaccine policy. The second overriding obligation of the employer is to keep workers safe. A worker also, when we talked about this under Section 28, has a duty not to work in a manner, i.e. in an unvaccinated state, that puts themselves or anyone else at harm. So that legal framework gives the employer, in my opinion, the right to say, especially in construction, we do have a right to say you have to have mandatory proof of vaccination to work at our site, because we want to move at our site to reduce COVID restriction rules for close proximity work, for even masking eventually, when public health also accepts that as a reasonable approach. So I think when you have a worker getting to the specific question that says, no thanks, I'm not going to get vaccinated no matter what, I'm not going to provide proof of vaccination. Apart from saying they don't want to follow your policy, they're also saying they want to be socially irresponsible. They're also going to be saying, I never want to travel outside of the country again for vacation. And they're really fighting the whole public health, political, and occupational initiative of getting vaccinated and getting through the process. Although it sounds oppressive to some or harsh to others, requiring as a condition of employment in a congregate or close working setting like construction, mandatory proof of vaccination when vaccination is clearly and provably available is not an unreasonable request. And in fact, in due course, you're going to see more and more legislation, in my opinion, actually requiring proof of vaccination, certainly for healthcare workers, for long-term care workers, and probably for educational and daycare workers. Whether it goes as far as construction, ultimately probably won't, because there's no other legislation that says you need a polio vaccination or a measles or mumps or rubella vaccination to work in construction, even though that could be potentially transmitted. But the presumption is once you've gone through the Ontario school process, because those vaccinations, the big five, have already been a requirement for a student, and that you are part of the vaccinated population when you finish high school, you're going to actually not be able to communicate measles to another adult. Measles or mumps to a child is often not serious. Measles or mumps to an adult is actually quite serious and even life-threatening. We don't deal with that at an adult level because through the school system, we've had mandatory immunization programs. The same will likely, in the fullness of time, apply to COVID-19. But we aren't there yet. We can't be there yet because the vaccinations still are an emergency approval. So what you're stuck with as an employer is the risk that if you don't have a mandatory proof of vaccination policy, you're going to have people coming to your workplace who, even if they voluntarily say, I will mask, I will physically distance, and you say, well, that's not really going to be sufficient for productivity. But quite apart from the productivity issue, masks and physical distancing, clearly, as we know, are not as effective as a fully vaccinated individual. So I think it's still reasonable to say, over a period of time, getting people to adjust to this concept that we want people at our work site to be fully vaccinated or to have an exception that's lawfully permitted. And if not, then you're not entitled to come to a work site because we don't want to put our coworkers in danger. And you should understand that. But if you don't, we understand and respect that, but you will not be permitted there. Getting union buy-in over time, I think, will come, may not right now. They may be still sorting it out. It's unfortunate we don't have more guidance and support from the Ministry of Labor, Training and Skills Development. As we've seen last month in Ontario with the long-term care facility, but I believe they should be going and may in fact in the near future be going in that same direction to say, look, you have a right as an employer, in fact, an obligation in long-term care to make sure all your employees are vaccinated, period, full stop, unless they're into an exemption. You don't have that framework support, so you as an employer have to take that on and manage that risk. But over a course of weeks and months of education, encouragement, and slowly getting people to give you information voluntarily, then you can evolve your policy to a full-on mandatory proof of COVID-19 vaccine policy. And I think it's perfectly lawful, it's reasonable, it's sensible. Your goal is to keep workers safe, and that's what you have to keep in mind that supports this position.
So I've got a very interesting question, one that I think from the OGCA standpoint, I'd really like to know your position on, which is, can an owner request the vaccination policy be implemented either halfway through a project or as part of the tender requirements?
Very, very important question. What I can say outside of construction is that a number of healthcare, hospital, long-term care facilities are already requiring tender and contractual commitments of service providers. For example, people who are going to be cleaning a hospital, people are going to be cleaning a long-term care facility to make sure all their employees are vaccinated, period, full stop. And they're of course contracting and pushing it down to that service provider. So by analogy, in my opinion, there's a very good argument that an owner can say, in a new contract, we want your employees and your sub-trades to be committed to a proof of vaccination policy and or proof of an exemption, and then accommodating or isolating or restricting the use of employees who are not vaccinated, but they do have the lawful right not to be, i.e. through a disability exemption under the Human Rights Code. So, but the second part of the question is, can you do it partway through a project? That's a little tricky. That it really depends on the language of the contract. I would think as well, it has to talk about the timing. And there'd have to be, I think, a certain amount of understanding, grace, or forgiveness of that implementation expectations if in fact it exists. In other words, you'd want pretty clear evidence in your part of the province that in fact everybody can easily get the second dose of the vaccination. That's still a bit of an issue. We don't have perfect and uniform distribution of vaccination throughout Ontario. It's pretty good, but it's not perfect. So there needs to be some thought, some dialogue, and some easing into that expectation. But I think because those contracts, mid-contracts, still require the GC to be compliant with all applicable legislation, including the Occupational Health and Safety Act, I think there's a strong argument that owners have to put that pressure on a GC.
So I've got two questions that kind of dovetail really well into each other. You talked about, again, the human rights exemptions that you can come up with and you can state as long as they're evidence-based. What if you just have an employee that uses a reasoning that it is not a bona fide occupational requirement to refuse vaccination? Would this differ for different roles, as in head office versus site role? So this is kind of an interesting question.
Yeah, I think there, lawyers like to debate these kind of issues, so I go on for a long time, but I'll try and keep this one brief. I think the answer from a human rights exemption or a compliance with a policy under the KVB test for a unilaterally imposed policy by employer, it is contextual. So the office situation might be seen differently than the construction site. As a starting proposition, I'll give you that. However, office workers are the responsibility of the employer to keep safe, as well as construction project workers, even though there might be higher risk there. So one still has that legal obligation. The interesting challenge, I think, for a lot of employers that have office staff and construction staff is whether they want to have a hybrid work model for their office staff. In other words, do they want to offer either intermittent attendances at the office, so there's less people consistently in the office going forward forever, or whether they want office staff to come in and collaborate and work as they did pre-COVID. I think if there's a good business reason, or just, that's the preference of leadership, there shouldn't be an overriding right on the part of a worker to say, I don't want to come into the office if I'm doing finance or payroll. I can do that remotely. I've been doing it for over a year. So that becomes an interesting human resources cultural challenge, that then may trigger the question of, do you want mandatory proof of vaccination? So it's, what are your business needs? What do you want to do in terms of your culture and your sensitivity to people who may have moved farther away from where they were working, and their commute's now twice of what it was. Now that's a consumption and choice of employees. It's not the employer's problem per se, but to ignore the preference, or to ignore the views, or and a lot of employers are surveying their employees on this, is a bit of a risky business, because you may lose good talent. So there's the HR and sensitivity concern, but when you move from that to then what the business concern is, and once you've rationalized the two, then your choice as an employer to require people to return to the office because they've had the opportunity to be vaccinated fully, is something that then you have to deal with. And if the office is such that, in most offices are, that you could from time to time be in proximity to other workers, I don't think the stay away more than 2 meters, the pre-access screening, and the masking is equivalent to a vaccine to protect workers. The evidence does not support that. So if we're focused on an evidence-based approach for keeping office workers safe, proof of mandatory vaccination and the policy we've developed is something that can reasonably, in my view, be used for office workers as well.
Okay, so we've got ourselves an anti-vaxxer, and because we don't have any specific legislative requirements for employers or GCs to mandate vaccines, what safeguards do employers, or GCs specifically in this case, have to shield from costly wrongful dismissal or breach of contract claims?
Yeah, I mean, I think the highly committed anti-vaxxers is a rare individual these days, but I'm sure they still exist. After the conversation, after providing information, if they still maintain that position, then you have a dilemma as an employer. Do you value the employee sufficiently to try and accommodate them? Or do you say, look, we want everybody to follow the policy as a condition of employment, and you have refused on several occasions to follow the policy, so therefore we don't have a position for you. You, in other words, do not meet that condition of employment. So what that triggers, as you've implied in the question, is a potential wrongful or constructive dismissal case. I think you're going to have to look at that case by case. It may not be worth your while, if the person is an office worker, to make the issue a condition of employment. Might just stay for office workers a policy that is strongly recommending, but gives room for the anti-vaxxer to come in and do their work. I mean, in theory, if you have 80–85% of your staff vaccinated, herd immunity reduces significantly, but does not guarantee that the worker who's not vaccinated might be infected, because the likelihood of the vaccinated employees who've done the right thing carrying the virus is very, very low. Not a guarantee, as we've heard from public health authorities and scientists. So it's a dilemma. Do you value that employee more, becomes the question, than the importance of the universal application of the rule? And I think in the context of an office where maybe there's a little more room for accommodation for isolation of workers, that's the case. But the more you give exception to that worker, the more you give right to risk for the employer taking the legal risk of not making sure everybody's safe. And then also you put the risk on employment productivity of another worker who's vaccinated, saying, well, look, I don't want to work with this anti-vaxxer. And so, yes, it pits vaccinated versus non-vaccinated employees against each other, but that's inevitable. That is not something that is the employer's fault. It's a tough balance to strike to keep everybody safe, to not have people refuse to do work because they're vaccinated and one anti-vaxxer isn't. But you don't want to, in effect, unfairly discriminate against a person who's an anti-vaxxer. However, that person, the anti-vaxxer, does not have a right to impose their anti-vaccine philosophy on you as an employer or other employees. So it's a tension. And because there's no lawful support under the Human Rights Code for anti-vaccination as either a medical disability or a religious reason or other prohibited grounds, then the rights of the majority in that case will, because they're safety focused, I think, prevail over the right of that individual. So you probably, on balance, and I'm sure there'll be cases, unbalanced in most workplaces, are going to have the right to impose that condition to the point of saying you are failing to meet that condition. Now, if you then no longer employ the worker, the question might become, well, is that a constructive dismissals because we've changed the rules such that we still owe the person compensation, pay in lieu of reasonable notice? The answer is likely yes. But on the other hand, an employer might be able to argue, and I don't believe this has been argued yet in Canada, that the change in the policy, a mandatory proof of vaccination policy, is required by something outside of the control of the employer and the employee. So there's frustration of contract. So the new policy, meant to comply with health and safety laws and protect workers, is a proper policy to have, such that if you don't want to comply and you don't have a lawful excuse to not comply with that policy requirement, then in fact the contract's been frustrated. That might not have a lot of appeal to a judge, but it's a potential argument that says you may not even have to compensate someone who refuses to follow a reasonable policy imposed by this worldwide pandemic on the particular employers trying to keep workers safe.
So I want to switch gears and stuff, and I can hear all about the anti-vaxxers and what. I think you can talk at length on that, just because it is befuddling at best. But let's talk about proof of vaccination. I want to make sure that the contractors and our members understand clearly what is the mechanism to demonstrate proof of vaccination. So just do a quick little walkthrough on that one.
Sure. Unlike New York State, that when you get fully vaccinated, like many US states, you get a QR code on your digital device. So a unique code that says, I'm vaccinated, that you can then use at an airport or demonstrate to your employer. Ontario and other provinces aren't doing that. What you're getting, as you probably know, is either a piece of paper and or an email confirming from Health Ontario that in fact you've been vaccinated first time and then second time. If you delete that email you get, or you didn't get the piece of paper, and some people are in that situation, you're all of a sudden feeling very awkward. You've been vaccinated, but where's my proof? So the lack of a well-organized rollout and a well-organized proof in Ontario is going to be a bit of a problem. But I think most people do have the digital or paper proof. So
but sorry, Norm, isn't it linked to your health card to begin with? I guess you can ask for it online for another receipt.
I believe you can. I've not done that personally. I've got mine, but yeah, I'm sure you can call or email Health Canada with proper ID, including your OHIP number, and you'll be able to get additional proof. I'm sure that's available. I doubt, that's not. It just might take a little time. So assuming you have proof from the Ontario government attached to your health card, your medical doctor or office should have that access as well when you give them consent. The question is, do you give that as a patient now got the vaccine to your employer? Or maybe the better question is, what do you show to your employer? Well, in the US, people are just forwarding their QR codes to their employers and they're collecting them. They're keeping it separate from all other personal information, and they're keeping it only for the purpose of workplace safety and confirmation they can come back to the office and not be physical distancing, not be masking. In Ontario, we're a little confused about the rules are public health wise. They're saying you still have to you still have to act as a non-vaccinated person, even if you're fully vaccinated, which is sort of undermining confidence in the vaccine, among other things. But what an employer should do is seek proof. They should seek it in one of two ways. They should either have that email confirming second dose sent to them, which is easy to forward on an email, or simply have it shown to somebody in the HR department or the supervisor, and have the supervisor record the fact that they saw, and it was represented to them to be not fraudulent, the proof of the vaccine. Don't really have to, in my opinion, note which vaccine it was, but just you need to know that it was a second dose and what the date was, because it takes about 2 weeks effectively to be fully resulting in the immunization response. And that's true for all of the three vaccines that are used in Ontario. So I think once you've had that record, then that should give you the comfort as an employer that you've got evidence to prove that the worker is fully vaccinated and, when allowed by public health laws, to be able to be working free of any restrictions, i.e. proximity to other people and without a mask and any other restrictions that might be required. Doesn't mean as an employer you can't go over and above what public health has said, but remember, we have no workplace rules, zero from the Ministry of Labor, Training, Skills Development, that are actually legally required on what it means to have at a construction site, for example, workers working without the vaccination being available safely but still lawfully. So it's the best practices from public health that have been used at workplaces, not from the Ministry of Labor, Training, Skills Development. So bottom line is you need reliable proof recorded to be able to demonstrate to, for example, the Ministry of Labor or public health official down the road that in fact you have a workplace that's vaccinated, that are able to work in close proximity to each other and to do so safely.
So on the proof of vaccination, easy enough for our contractors to have that policy with their own people that they employ. How does that extend to the subcontractors or third-party workers, say like the Ministry of Labor? Can we bar access to the Ministry of Labor on our sites if they don't demonstrate to us proof of vaccination?
That's a real fun question. I think the short answer is if your policy is in place and it's posted and communicated to your subcontractors, then that would include any visitors, including the Ministry of Labor. I would do so respectfully. I wouldn't do it provocatively, but yes, you don't want a Ministry of Labor inspector to be walking around on your site unmasked in close proximity to other workers or their colleagues without proof of vaccination. I think to ask the question of a visitor, including a Ministry of Labor inspector, is reasonable. And if they don't either respond, yes, I've got proof of vaccination and here it is, or they respond that it's none of your business, they're the government inspector and they can tell you what to do, not the other way around, then you would say respectfully, well, that's fine. Please make sure you follow all of public health and safety guidance. We want you masked at all times. We want you 2 meters away or more from everyone. And if you have a temperature check protocol, which I've recommended from day one of the access process, then away you go. And you'll also be required to ask them the COVID questions that the province has set out to make sure people are not self-aware of symptoms before they come on the site, which hopefully the inspectors are quite familiar with because they've been laying charges against some of my clients when they haven't been doing that. So, you know, they do need to follow the rules as well. And I think you have every right to ask them to do so on your sites.
What's a reasonable time frame for employees to get vaccinated?
It's kind of following the media coverage of public health protocols in different parts of the province. I think the best approach is to have a policy that strongly recommends requirement of proof of vaccination and to start collecting it on a voluntary basis. But over the next, say, 6 to 8 weeks, we hope by the end of August, for example, that every Canadian who has the ability and wants to be vaccinated can have a vaccination and a full vaccination, i.e. both the second one done. So you need to make sure locally that the vaccination is available. You need to have that conversation with the employees generally, give them heads up, facilitate awareness of where vaccinations may take place in their city or region. And if there's a clear indication by one or more employees that they don't want to ever get vaccinated but don't have good reason, is to have that dialogue with them. You may very well want to build in some consideration or grace for people who don't have a lawful excuse not to be vaccinated, or you may decide to go to fully require mandatory proof of vaccination, which is the recommended approach. But either way, one wants to develop and implement the policy with knowledge of your current vaccine eligibility and availability for workers, so that you don't put pressure on them to be fully vaccinated before, of course, they have a reasonable opportunity to be vaccinated.
So I've got a very interesting scenario that's come up here. And the question is, so what if, again, hypothetically, in this case, it could be realistically, you have a site supervisor who is an anti-vaxxer and very vocal about their disdain for the vaccine and anything like that, and not willing to abide by any of the rules and regulations that you've put in, and is basically contrary to everything that you're trying to do to keep people safe. What do you do then, other than, hit the road, Jack?
I think you should have a conversation with them and afford them an opportunity to be heard on why. Maybe it's prior bad experience with a vaccine. If that's the case, you have them put on a temporary leave so they can get a doctor's appointment as soon as possible to go talk to their doctor. If they can't get a medical reason in writing why they shouldn't be vaccinated, then in fact, I think it's really important for a person in that position to be told they'll be given one last chance to either support the vaccine policy of the company, to recognize that it can and will save lives, and that many people are literally still dying in Canada because of the kind of attitude that supervisor demonstrates, which is not only irrational, but it's reckless. And if they are going to argue that point with you, and some anti-vaxxers will, then you'll respectfully decline to continue to employ them. Whether you give them working notice, or perhaps whether you can find them a job that accommodates, in effect, their resistance. I was going to say insanity, that's going a bit far, but the resistance to the reasonable, which might be a definition of insanity, then because you value them and maybe they can do some sort of function for the job other than, or for the employer, other than, hands-on direct work with workers and supervise them, then I think, you want to look at that possibility if they are otherwise a valued employee. But to be socially reckless, to be having no medical or other sound legal reason not to be vaccinated, but simply to have an irrational ideological position against vaccines, is something in a free country they're entitled to, but in a free country you're obliged under law to make sure workers are safe. And that is a way to explain to them why you can't continue to employ them, at least not in that position. I don't think there's going to be much sympathy in the courts or at arbitrations for people who take an irrational and fundamentally reckless position with their own health, but more importantly, with the health and safety of others.
So again, on the stream of health and safety of others, I've got a question about, so you've got people who are being vaccinated and they wait their 2-week period. Now they don't want to wear masks because they've been fully vaccinated. What do you do? Because they're struggling with the heat and humidity. What now? How do we, you still have to enforce the health and safety protocols, but can you be lax? Can you not?
That's where you and I, Giovanni, should talk to not only the Ministry of Labor, but also the public health ministries, and saying, look, the CDC in the US and most other organizations internationally have said that a fully vaccinated person has no risk of getting sick or ill or worse from the vaccine, and has an extremely low risk of being asymptomatic and being a transmitter to others. So therefore, once a workplace or a crew has been fully vaccinated and you've documented, not only are they safe, but they should be safe to work without masks in particular, and safe to work without restrictions on proximity of 2 meters or more. So, but the fact is, the public health authority have legislative power to have the rules in place that they do. And that's where there needs to be government coordination between the Ministry of Labor and public health to be able to say, look, let's have a sensible position. Once we've got proof of vaccination and crews are fully vaccinated as they've been eligible to be, then we need to be able to make work more comfortable, in effect more safe, by removing the masking rule in particular. But you can have a situation where you have a safe workplace where everyone's got proof of vaccination has been recorded by the employer on the one hand, and yet you still have to comply with local or provincial health and safety requirements. And that's where there needs to be a little bit more high-level coordination between, government departments. Essentially, they really need to be on the same page.
So I've got two more questions and then we'll cap it off, just because there's just a litany of them still coming through. It does sound to me that some of the members do want to know more about the KVP test. So if you want to, perhaps we'll have something written up in a future newsletter or article that comes up.
Sure.
And then that will be something that, we can dive into depth on. We don't have the time for it here. But good question. What type of proof would be considered an exemption from vaccination? Doctor's note, family physician, surgeon, specialist, note from a recognized religious affiliation. What would constitute an exemption?
Yeah, let's go back a step. So there are exemptions to a mandatory proof of vaccination rule, in my opinion, under human rights legislation that says if a person has a disability or a perceived disability, in other words, they cannot take the vaccine safely, so it's a medical or physical disability, then that needs to be established by proof, by due diligence, and that is a medical practitioner. That's the rule in the provincial government's long-term care policy, published and available online publicly, and that's the best practice that I would recommend as well. Now, in theory, as you've mentioned, a sincerely held religious belief by an established religious organization or faith that says we, for reasons related to our faith, prohibit our members from being vaccinated with the COVID vaccine, then there would need to be written proof of that. There have been some cases in the past where people have said that, well, I'm a committed anti-vaxxer and that's my religion. Those arguments have been rejected by human rights commissions in different contexts. And they've been less serious contexts. In other words, it's been dealing with seasonal influenza, not a worldwide COVID pandemic. So there's less of a likelihood that that would ever be sustained as a legitimate exception. So you'd need something in writing. You can't just have people making stuff up or imposing their subjective beliefs on the organization and putting other employees at risk without there being that evidence. And then once you do that, once you have medical evidence that this person cannot be vaccinated on the advice of their doctor, the doctors confirm that in a doctor's report, then you need to accommodate to the point of undue hardship. What that means really depends on the context. It means if you can accommodate the worker at the work site or off site, then you have to do that. But you don't have to go so far, i.e. undue hardship, to create a job that didn't exist for them before. If you have something they can do that they can do remotely, fine. And you may have to deal with them down the road in terms of herd immunity or population immunity when public health guidance changes, or in fact, COVID-19 gets absorbed, as it probably will in seasonal influenza, and becomes less of a pandemic risk. So, how that mutates is something beyond really my area of expertise. But when we go back to the Spanish flu of 1918 and 1919, essentially it was absorbed into seasonal flu. So it didn't become as lethal as it had been for many, many years. So it's a partly medical kind of answered question, but if you do have somebody seeks an exemption from your mandatory proof of vaccine policy, you want to see it in writing. You want to be able to verify it.
So Norm, I doubt that you have limits to your expertise, but that's another conversation for us to have.
I do. I definitely do. Unlike you, my friend.
Oh, please. Anyway, so last question. And again, this is just to reiterate, someone is asking, so can you legally add into a contract that proof of vaccination is required?
Yes, but I would do so carefully and only with legal advice, because there are exemptions to that rule. So you'd want to have some language that recognizes that there will be small but legitimate number of exemptions or employees that may be exempt in that type of rule. And so I think, yes, you can have that in your contract, but it has to be properly drafted and recognize that you can't have an absolute rule. It has to be a rule with the flexibility for exemptions.
Norm, can't thank you enough for your expertise and diligence on this subject matter. Again, to all of our attendees, this webinar has been recorded and we'll be distributing it afterward to the attendees. The questions have been fantastic. If you have any further follow-up questions, either direct them to the OGCA or to Norm himself. We're happy to assist in any way possible, and we're here to answer any questions that you may have. So with that being said, thank you all for attending today. Norm, you are fantastic as always, and you look way better with the haircut.
Thank you. Take
Okay,
care.
one and all, have a great day. Stay safe. Take care.